The $6.8 billion allocated in the 2022 budget to respond to the COVID-19 situation in Guyana forms part of the $73.2 billion budgeted for the health sector, which sets out government's priority for the procurement of 260,000 doses of vaccines to be utilized for booster shots and for the unvaccinated, among other things. Health Minister Dr. Frank Anthony, during his COVID-19 briefing on Thursday, outlined that the funds, once approved, will be used to purchase COVID-19 vaccines for children between the ages of 5 to 11 years old. In November, the immunization of children from that age group was delayed since the minister had indicated that efforts to acquire the specialized vials from Pfizer-BioNTech in a timely manner were abortive. At present, vaccines are offered to children in the 12 to 17 age cohort as well as adults.
Our understanding is that Pfizer in the first quarter of this year would also be submitting their information to the US FDA for a vaccine which might be a 3-dose regimen for children between 5 to 6 months. So if those vaccines become available this year, then obviously we would like to have access to those vaccines.
The minister further stated that the proposed sum would enable the expansion of cold storage facilities used to house the vaccines and procure oxygen for critically ill COVID-19 patients. The minister is anticipating that 2 new oral medications can be added to the country's treatment regimen for COVID-19. The drugs include Paxlovid, which was developed by Pfizer, and Molnupiravir, created by Merck.
Of course, we'll continue to purchase Remdesivir, which we've been using for some time now, and Baricitinib, which we've also been using. So these medications sometimes can be very costly. So we have set aside enough monies to be able to acquire these medications.
In December, Guyana began using Baricitinib, a pill which is highly recommended by the World Health Organization. Other essential items such as personal protective equipment will also be bought, the minister added. Guyana continues to see a steady rise in new COVID-19 infections, with approximately 18,000 new infections for January alone. Dr. Anthony lamented the slow uptake of booster shots, which he reiterated offer more protection against the surging Omicron variant.
These numbers need to go up, quite a lot, because our booster doses, we really need people to come out and get their booster doses.
Temika Rodney reporting for the HGP Nightly News.